Thank you, Dr. Asanti, for that enlightening presentation. And we're very, very sorry about the time constraints. Due to time limitations, we can take one or two questions from the audience, preferably one or two.
Hi, good evening. So my name is Rubina, and I work for an organization called MAS Holdings. So for over 3 decades, for a period of time, we have been conducting a lot of training, and we have reached out to communities, especially on menstrual hygiene and menstrual health. I'm also leading a program called Women Go Beyond, and I look into women's advocacy in a division of 17 factories in Sri Lanka and across the globe. So we all talk about this subject. We know that there is some work being happened, but as a peer trainer, I would like to share a few of my thoughts and my experience, and my question will go to Dr. Asanti. So when you go to schools and when you teach this education, we get a clearance from the schools and we show them the content, and this is what we are going to talk, and these are the products that we are going to show. And the first question they ask is, are you going to teach this in front of the boys? Are we going to use words called yoniya, vagina, vulva? We should not talk about those words. You should use chupatta, kakipatta, things, words like that. And even if you show a picture, there's a lot of stigma and taboo surrounded about that. And when you ask a child, are you on your periods? Do you know how it starts? No. Mata maasakata ledak hadenawa, germ ekak hadenawa. That's how that's what they've been told. So what are we doing? Like, I know a lot of organizations, private constitutions are doing a lot of work on this space. But as the government, what are we doing? And I've never seen, sorry to throw this question, I've never seen those curriculum or anything, because when I speak to children even, they say, teacher කියලා දෙන්නේ නැහැ. Teacher කතා කරන්න බයයි. Teacher ලැජ්ජයි. So
Sorry, due to time constraints, can
yes,
we just get the question across?
So what are we doing and what can we do?
I think good question. This is the big issue. This is a big challenge for everybody. So CSC is a big challenge for one. I think yesterday from the some sessions also we talk about. So we all have to go together. That's why Parliament caucus also asked. That's why Health Promotion Bureau, other than the Health Education Ministry, they are doing a formal education. So we had taken the responsibility to work with you and to give, at least to give the information. So it takes time, but there's a positive trend we can see. So these even these platforms, even this conference also given a good positive things for the one. So we all have to together, because it's a very sensitive area. We know how much difficult to address these issues. So as a Health Promotion Bureau, always we help in the Health Education Ministry also. Big issue is the communication issue, stuff there. So sensitive area. So there are misleading things are there. So we have to brainwash and brain. So this is the thing. Open dialogue. Create, at least you do whatever you can in your level. So ultimately by another 10 or another 1 or 2 decades back, this will be get to normalize, right? So we all have to work together. This is the big challenge. I think during this years from since yesterday, these are the issues we are addressing. Okay, thank you.
Sorry, due to time constraints, we've been asked to finish the session, but our panelists will be available outside. If you have any further questions, you're more than free to ask them. Thank you so much, everyone, for joining us today. Thank you.